firstly begin with our introduction to electronic health information and briefly define the three categories for you. Then we will go in more in depth as to what an electronic health record is and the benefits associated with it. We will then discuss and explain the three major benefits individually, as well as other benefits associated with EHR. We will then briefly brush over some of the key challenges and obstacles that is present when it comes to implementing electronic health records in our health organization. We will then look into specifically Ontario and its progress with electronic health implementation, and finally end off with a concluding summary. Many systems are evolving to store and preserve health information electronically within our health organization and institution. Electronic health information is actually categorized into three specific groups. We have electronic health records, electronic medical records, and electronic patient records. Electronic health record, according to Clark 2015, is a digital version of a patient's paper chart that can be used in multiple locations. Electronic medical record, according to Clark 2015, is computer-based clinical data for an individual that is kept by a single physician office or the community health care center. Electronic patient record, according to Clark 2015, is computer-based clinical data for an individual that is kept by a single health organization such as clinics and or hospitals. Notice that all three are very much similar except for the major difference, the location as to where these records are kept and stored. For our presentation purposes, we will be focusing on electronic health records and the benefits that are associated with it, and as to why it should become prominent in our healthcare system.
What is an electronic health record? An electronic health record contains the results of clinical and administrative encounters between a provider, such as physician, nurse, telephone triage nurse, and others, and a patient that occurs during episodes of patient care. This includes information such as demographics of the individuals, such as date of birth, gender, postal code, ethnicity, and etc. Their clinical diagnosis, which is their current medical condition of the patient and why they have been admitted to the hospital. Test results, which can include blood work, CT scans, and urine tests. Medical histories, if the patient has been diagnosed with other medical conditions, family history, previous medications, or previous surgeries. Also, there is medications, if the patient has been prescribed any medications by the physician, how often they need to be taken, the dosage amount. EHRs incorporates both electronic medical records and electronic patient records.
The purpose of this presentation is to present the various ways that electronic health record can benefit healthcare professionals and how it can benefit our overall healthcare system. The first point in the slide states that the implementation of electronic health records will decrease the number of paper being used. We will be speaking to you about the three major benefits that are linked with electronic health records. These points will later be elaborated on, and they include increased quality care and better patient care, increased efficiency and productivity, as well as financial betterness. The first benefit that will be elaborated on is how electronic health records increase the quality of care being delivered and how it improves patient care. The quality of care being delivered is increased in various ways when using electronic health records. Electronic health records is used to store a patient's information in one safe and reliable place. By doing so, it makes it easier for healthcare providers to provide the best available care and make effective decisions. Through electronic health records, the data is available whenever the healthcare provider needs it. Furthermore, through enhanced coordination among healthcare providers, electronic health records also leads to better patient results and quality of care. According to Clark 2015, allowing health professionals to have immediate access to patient information decreases the number of errors and unwanted tests. To demonstrate the importance of electronic health records and how it improves the patient and quality of care, we can look at e-prescribing. E-prescribing, or electronic prescribing, is a technology framework that allows physicians and other medical practitioners to write and send prescriptions to a participating pharmacy electronically instead of using handwritten or fax notes and calling it prescription. This is convenient for both the patients and the providers, as it enables patients' prescription to be ordered and completed before leaving the provider's office. The staff and providers usually file insurance claims directly from the provider's office. Providers may be able to have access to patient files, submit the prescription remotely, whether it being at home or while on vacation. Hence, electronic prescribing improves patient safety and the overall quality of care. privacy, we see that there's easy access to patient information. Information is updated and current. There's reduced paperwork, increased liability, and sharing information increases as well. On the other hand, when we look at productivity, we see that there's no regulation of healthcare workers, reduced record storage space, increased electronic health record resulted in higher productivity according to Clark 2015, decreased patient wait times, and elimination of lost charts.
The use of electronic health records have been proven to be financially beneficial for a variety of reasons. Usage of an EMR in ambulatory primary care showed that there was a reduction in making paper charts and transcriptions. In general, making a paper chart or a transcription cost $5. However, by using an EHR or an EMR resulted in a reduction of 600 paper charts, as well as a reduction in 28% for transcriptions, thus saving the healthcare facilities $3,000 per year. There was also seen a decrease in the use of other utilities by providing simpler, more beneficial alternatives. Using less expensive drug alternatives resulted in a 15% increase in savings, and lab and radiology usage was reduced by 8.8%. Other factors resulted in the benefits in fee-for-service reimbursement by reducing billing errors as there is more accurate data being implemented into a computerized system. We have seen that billing errors actually were reduced by 78% because of an EHR accuracy rate. In total, there was an increase in revenue as the EHR saved the hospital $86,400 over a 5-year span.
The benefit of electronic health record is continued and divided to 3 categories: clinical, organizational, and societal outcome. For the clinical outcome, first one is improvement in the quality of care. Electronic health records rely on the accessibility of the information. Since all the information can reach at any medical center, it would ensure that all patient information is up to date, so the treatment decision will be more accurate and faster to make them. At the same time, the patient don't have to repeat the test that already was made. The other one is reduction in medical error. Since there is a reliable and secure system called CBOE, which is standard to computerized physician order entry between physician and pharmacist, it will help to reduce the human mistake when it's come to mixing medication and dosages. When it's come to the organizational outcome, reduction in the financial and operational performance is the main advantage. Medical centers spend their asset trying to maintain patient medical record or transfer it. Having an electronic copy of all the chart, it would decrease the cost in the long term, since there is no need to print it in order to have to look at it. Lastly, the societal outcome, and that means being able to conduct research. Having an endless information would help researchers to conduct study and focus on specific criteria would suit their purposes. Endless to say, researchers can address their society issues based on public information that they get it.
Despite electronic health records proving to be very successful in the healthcare system, it does face its challenges and obstacles that health professionals have to overcome, some of which include fragmentation, disincentive, privacy issues, and the conversion from paper to computer. When looking at fragmentation, it is mainly due to a variety of different healthcare facilities utilizing different EHR systems. This creates a lack of coordination between healthcare professionals, such as doctors and dentists, as it makes it difficult to properly treat the patient when they only have their own information to rely on. Moving on to disincentive, it is mainly due to the implementation of EHR systems leading to the loss of productivity. Implementing EHR systems does take time to learn, and physicians are trained to use the new system, but this affects their workflow as it is new to them. A study was executed to estimate how much of a handicap the new EHR system was to medical clinicians. Results showed that there was a 20% loss in productivity in the first month, 10% loss in productivity in the second, and 5% in the third. Moving on to privacy issues, it is basically Training health professionals doesn't just affect the ability to work effectively, but it also allows for a vulnerability in confidentiality and security. Implementing the EHR allows for a susceptibility to breach or leaking of patient information due to unqualified or untrained employees operating the new system itself. An example of this would be an extreme case of breach of privacy was when in 2016, the Advocate Healthcare Network compromised 4 million patient information out to the web. And finally, the conversion from paper to computer. Now, this is a new concept, and the implementation of electronic health records takes time. The use of paper records are still present in today's healthcare facilities, as there are thousands of patient data. And in order to convert from paper to computer, takes a lot of time and care in order to make sure that the data being inputted is accurate and thus affects workflow.
eHealth Ontario was established in 2008. eHealth believes that communication amongst individuals and organizations could be improved by comprehensive data about the meaning of the term. eHealth Ontario has built a suite of web applications called eHealth Services. eHealth Services offers authorized clinicians with access to Ontario's provincial data repositories, allowing them to search and view information about patient care electronically. Having more comprehensive access to patients' medical history, such as lab test results and diagnostic imaging and reports, help provide to make a timelier, better informed treatment decisions and improve patient care. Information that can be viewed includes diagnostic imaging, which allows authorized providers to search and view a patient's diagnostic imaging reports located in any of the 4 regional diagnostic imaging repositories. A search can be performed by a procedure date, a session number, facility and/or procedure name. Benefits of diagnostic imaging include viewing summary of original report, quickly filter or sort results, see additional information such as ordering clinician or who copied on the report. There you can also view patient lab reports. Patient lab reports allow results authorized by providers to search and view a patient's lab test results and reports from the Ontario Laboratory Information System repository. Users can search by collection of date or time, test result name, category, order number, or results indicator. Benefits of patient lab results include that you can quickly identify high and low results, get an overview of the original report, quickly filter or sort results. Lastly, you can also view Provider Registry. Provider Registry allows authorized providers to search the Provincial Provider Registry to find a healthcare provider in Ontario by name, profession, or registration ID and issuer. It enables them to select a provider to see a complete view of the provider's profession and specialties, locations of practice and registrations. Benefits include it combines data into a single repository, quickly finds a suitable provider or specialist to refer to a patient, and includes all medical professions.
In conclusion, there are different types of electronic records, which includes the electronic health record, electronic medical record, and electronic patient record. To review, electronic health record refers to the longitudinal electronic base record that is used and collected over time in multiple locations. Electronic medical record and electronic patient record are usually used interchangeably, and they're both defined as electronic record that collects patient data used in a single organization such as a hospital or clinic setting. Electronic health record also improves quality of patient care and reduces errors. This is by providing up-to-date information for accuracy in patient diagnosis and treatments. It reduces errors since it allows for embedded indicators to catch mistakes. An example of this would be when a physician is writing a prescription for a patient using the electronic system. They are oftentimes alerted if there are patient allergies to medication and/or adverse effects with another medication that a patient may already be on. Electronic health record has also had a positive impact on healthcare costs. Some of these impacts would include the paperless charting, which has had a significant impact on the cost, and also another would be a reduction in billing errors for physicians. There are also challenges and obstacles involved with the system, which includes gaps in knowledge, potential for breach of privacy, lack of access, and usability. Breach of privacy would include hacking of the electronic health record that contains patients' sensitive, personal, and medical information. With paper charts, accessibility was easier in the sense that it wasn't password protected, and if information needed to be accessed, it would be more readily available than an electronic health record would. eHealth Ontario also allows for better patient outcome, since it includes web-based applications which allows for authorized physicians to have access to Ontario's provincial data repositories, which allows them to search and view information about patients and their care. Having more comprehensive access to patients' medical history, such as lab test results and diagnostic images and reports, helps providers to make timely, accurate treatment decisions, which improves patients' prognosis. This also allows physicians to search for other specialties in order to make timely and accurate referrals, which also assist in better patient outcomes.